I get to share some time with Dr. George Ghneim. Welcome, Dr. Ghneim.
Thank you very much. Thank you for having me.
It really is our treat. I'll give a brief intro. Correct me if I'm wrong now. But Dr. Ghneim, you are the owner of Oak Heart Veterinary right here in Raleigh with 3 locations. And you're actually from the left coast, but that's okay. You came in from San Francisco, was where you got your degrees, is that correct?
Well, I grew up in San Francisco and I went to University of California, Davis, which is just about an hour away from San Francisco, pretty close.
And you actually have a background in infectious diseases.
That's correct. I actually, after going to vet school, I went on to do a PhD focused on infectious disease and moved to Raleigh for a job at the state health department where I was working on surveillance for infectious disease and worked on quite a few things, including influenza for a while.
What does that mean, a surveillance? You just keep them under the microscope, make sure
Right?
what they're supposed to do?
We were actually working on a system to catch outbreaks of infectious disease. So really similar to what's happening right now, where we were looking for something strange that would happen that wouldn't fit the normal pattern of diseases seen.
Wow. How relevant in today's environment.
Very much so.
And you moved to Raleigh with your family, and you've opened 3 locations at once, or how did you progress from research into actual caring for our beloveds?
So I worked in public health and research for about 5 years, and I really missed being part of the community on a more local level. I love doing public health. I love the mission of it, but I really was sitting at a computer, all day, every day, and I wasn't interacting with people like I really wanted. I had opened up a restaurant in downtown Raleigh and really loved the local scene, and my dream was to end up with a vet hospital near downtown. Now, it took a while for that to happen. I am an owner, but I partnered with a group called Vets Pets, and they're a family-owned hospital group out of Wilson, North Carolina, and they've helped me realize my dream. We started out with 1 location, but after lots of discussion and seeing what wasn't there in the central Raleigh area, we ended up with 3 hospitals. One of them was already here. It was a Dixie Trail Animal Clinic. We bought that and we renovated it. But the other 2 are new hospitals serving an area that didn't have a vet hospital already.
Well, that's fantastic. I was creeping on your website, and I noticed the one down on South Saunders was right next to one of my favorite local nonprofits, Cause for Paws.
Yeah, absolutely.
Which is a thrift shop that raises money for our local fur babies. So
yeah, so the location at South Saunders was the first one that I was looking at. It actually used to be a furniture store, and ironically, I had a commercial realtor looking for a location for me, and she called me up about the spot. It wasn't even listed on the market. Well, it turned out it was a former client of mine, and he sold me his family's old furniture store, and it's just been a dream come true. And that's really our flagship hospital. That's the main Oakheart Vet Hospital. It's a large facility. We normally have grooming, daycare, boarding, and really it's a full service hospital. We see a lot of sick pets and emergencies there as well. And eventually we hope to make it a 24-hour hospital.
What services then? Well, so we appreciate that. What I like about your story, Dr. Ghneim, is that it really is a fine example of the power of local, right? You identified a need in our backyard. You came in and said, we need to do this not 1, but 3 times. It reaches all the way to Wilson, and it's a phenomenal story. So that's fantastic, and we wish you all the best. And look forward to bringing my cat, Miss Luna Tick, into you here. But part of what we're doing every day is trying to share stories about our quarantine. And so how has this COVID-19 situation affected you and your practice?
Well, first of all, I want to say I'm so lucky and blessed to still be working. I know there are many people out there that have been impacted in such a hard way. I have a lot of friends still in the hospitality industry, and it just breaks my heart to see what's going on. We're considered an essential service, so we are still operating. We've modified the way we're operating. We don't have any clients coming into the building. We're having people pull up in their cars and call us, and then one of the employees with gloves and mask will go and we'll get the pet and bring it inside. We then talk to the clients on the phone to get the history and all the information. We do whatever the pet needs. We call them back. We go over everything. We check them out over the phone. And we take the pet back out. So that's the first thing we started. We did that voluntarily. We started that about 2.5 weeks ago.
Too early.
Yeah. The vet school, NC State, College of Veterinary Medicine did that first, and we followed suit a little after. So since the shelter in place order, we are now not doing elective procedures. So that means animals that are, let's say they're not really due for their annual exam, they don't need any medications, those we're rescheduling. Any elective surgeries where they're not sick, it was just kind of a routine thing, we're rescheduling. If an animal needs a rabies vaccine, we are doing that. If it's a puppy that's due for vaccines, we are doing those because they're at risk. So those are
Right.
considered, important, not elective. And it starts to get a little tricky when you're talking about certain procedures, like a dental cleaning, for instance. If it's a routine dental cleaning and there's not a problem, that's not important right now. We can delay that.
Right.
That's elective. But if you have a dog with a dental abscess, then that's
Right.
something that would be done right now. So it's, I mean, we're still open, and of course, anything that's sick, we'll of course see right away. Any kind of injury or illness, we see right away. It's definitely impacting us. We are not as busy, but again, we're very lucky that we can continue to operate. We can continue to help people and their pets, and our staff are really maintaining their positions. There are a few things that we're not doing at all, like grooming. We're
Right.
not doing right now, and boarding we can do for people that are going to help, that have an essential job.
Oh,
So, although very minimal, right? So we're definitely seeing an impact, but we're going to be fine. We're going to get through this, and we're going to continue to grow and prosper after this is over.
yes, I believe more than ever, the power of local is going to really become more and more important. Having Dr. George Ghneim right here in your backyard, where when your fur baby gets sick, you want to be able to look the doctor in the eye and go, "What's going on?" And to have someone of your expertise and experience, we are very lucky. So thank you for sharing your time with us. Thank you.
Thank you so much for having me.
Um, and on a side note, I have if you have 2 more minutes,
Yes, absolutely.
I have a couple questions. Do you ever get bitten or scratched?
Sometimes we've actually gotten pretty good at knowing how to handle animals, and the thing to keep in mind is 99% of the time we're bitten or scratched, it's because that patient is nervous or scared. And so, really minimizing their stress, minimizing how anxious they are, is the most important part of that. And yeah, it happens sometimes, but we're generally gotten pretty good at managing that. Sometimes we'll give them a little bit of a sedative. Sometimes it's a matter of wrapping them up in a towel or putting a muzzle on. But it
Right,
happens sometimes.
right. So now that our families are home, it's not only me and the kids, it's me and Miss Lunatic. Um,
Right.
do you have any advice for how to get along with our pets now that we're spending more time than ever with them?
Well, I'm sure you've seen some of the memes going on where the dogs are part of the conspiracy to get you to be home. So
Yes,
with dogs, it's really they're excited that we're home, going for more walks. Obviously, not mixing with other people. But I've been walking my dogs a lot more lately, and they've really loved it. And I think the same is true for cats. It's really most of them desire our interaction, and really it helps our stress level and it helps their stress level.
right.
So just spending more quality time together is is a wonderful thing to do, and I think it's much easier to do with your pets than with your family sometimes.
Yeah. You have learned that exact moment to quit scratching and back off. Well, one more that has popped up. Can pets pass the COVID-19 virus to each other and then bring it into the family unit?
So far, all the data indicates that pets cannot become infected with COVID-19. Um, there were a couple of cases where they said a pet tested positive. I know with one of them, it was a really weak positive, they retested it with a more
Ah,
accurate test and it was negative. I don't know what happened with the other one, but in general, there's been thousands of tests done on pets and they've been negative. They do not carry this virus. There are different coronaviruses that people get, that pets get, but the COVID-19, as far as we know right now, does not infect pets.
that's great. So we can, in closing, safely say it's a great time to enjoy our backyards with our family and fur babies.
Absolutely.
If there is an emergency, we can call Dr. George Ghneim. And then once we are back into our normal routine, we can bring them all in for their normal procedures.
We would love to see you guys.
Great. Well, thank you for your time, Dr. Ghneim. Look forward to seeing you again soon.
Thank you very much. Really appreciate you having me today.
It's our pleasure. In Raleigh, Dr. Ghneim, and all this is right here in your backyard.
Have a great day. Thank you.
Thank you.